Here's how the chair usually looks when you come into the operatory. It may be inappropriate for what you want to use it for, so you need to move the light pole for the right-handed operator. You move it all the way to the left side, up as far as it'll go, and then bring your bracket tray around toward the right side where you're going to be sitting. Then adjust the bracket tray to the correct height so you can easily reach your instruments. If you're going to set it up for the left-hand operator, you would move everything over to the left, bring the light pole all the way around on the right. Remember that the patient will be getting in from the left-hand side, so you bring this all the way up. The patient should not be able to get in on this side. And then bring the saliva ejector and the high volume suction and the air water syringe to the proper place so that it's easily accessible to you when you're the left-handed operator. Here we have an operator's chair and we have an assistant's chair. Let's talk about the assistant's chair first. What we tend to see is most people don't know how to use the chair appropriately, and if we demonstrate here, I'll show you how most people tend to use it. First, they try to figure out how to use that strange little arm that's coming across there, which they usually can do. They sit down, and there you are. But that's not exactly right, because the assistant needs to be sitting in a much higher position. And if you'll notice, the chair has a metal ring around the bottom that allows you to put the chair up much higher and then put your feet on that ring and then bring in the arm to support your body. This allows you to sit in the correct position next to the patient across from the operator and pass instruments, and that little arm there supports. So here you can see how the arm supports you. It can be adjusted. It needs to be right up near your rib cage to support your upper body so that you can actually lean over your patient and have both hands free, and you won't be in danger of falling over, and you can hand the instruments to the operator like so over the patient. And this is a comfortable position to work as well, and very stable. So now we see the correct operator positioning. Your thighs should be more or less parallel to the floor, and you should be sitting on the front of the chair and not let the back hit you at all. You shouldn't use the back of that chair at all. That allows you to have total freedom and the ability to move around very easily, which you're going to be doing a lot of during the day. If you sit with your back next to the back of the chair, you won't have the same type of mobility. Just try it for yourself and you'll see. So always sit on the front of the chair. Then you want to sit up straight. Don't hunch your shoulders up like that. Keep your shoulders down and your elbows at your side, and then your forearms are parallel to the floor. Here, if you press this little button, you can drop the arm to allow the patient to get into the chair more easily. So the patient can just sit and then slide in and then raise the arm. And of course that's on both sides of the chair. And you can ask the patient to sit up a little bit to loosen up that plastic a little, and then adjust the headrest so that the headrest is just an extension of the back of the chair. It doesn't have to go forward or backward at all. It should just be flat, even with the back of the chair. Then you want to tell the patient what you're going to be doing. You're going to be putting her down into the supine position, so you let her know what you're going to be doing. It helps a little bit to put your hand on the patient's shoulder to reassure them as you move them down into the other position. Sometimes you may want to stop halfway down to give the patient time to adjust to a new position, and then you can go down to the other position. Always explain that it'll be like lying flat on their bed without a pillow, and it may feel like it's going to be a little bit low at first, but they'll get used to it. Always check with them to make sure they're comfortable before you go any further. Here we see that the patient's in the supine position, and if a plane goes through the patient's nose and is parallel to the floor, it should cut off her toes. So actually, she might be in a little bit better position if we lowered her down even a little bit more. Now you can see that the plane going through the nose would actually cut off the toes. If the patient feels that it's a little bit low, you may want to raise it just slightly. This shows the correct operator position, in the neutral position, and then turning slightly toward the patient and being in a good position to see with the light coming directly down into the patient's mouth. Now you can see that I can get a finger rest in the patient's mouth. Here you see the light is coming down directly above the patient's mouth, creating a line that's 90 degrees to the floor. And the patient's plane of occlusion of the maxillary arch is going to be at 90 degrees to the floor, or even a little bit more. If we tilt the patient's head forward, the plane of occlusion of the mandibular arch will be at 45 degrees, and we still can see very well. Again, we want the patient's maxillary plane of occlusion to be at least perpendicular to the floor, or even a little bit more toward the patient's forehead. So you can see this in this picture, that the patient's maxillary plane of occlusion is indeed in that position. What this allows us to do is, when we're in the rear position, for example, you can get good visual access to those maxillary teeth without leaning over the patient. I'm going to say that my hip is right next to the patient's shoulder. I'm now open slightly. I'm in the position for working in the mandibular arch all the way across, like so, everywhere. Now if I move to the 9 o'clock position, all I need to do to chin down is move like this, and I can retract like so and do these facials. And then when I go to do the maxillary arch, I can turn like so, and I can probe, turn to the right please, close a little bit. I can probe these areas back here. Okay. I can take this out and palm it, and I can turn toward me please. A little bit more, 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 open. I can also probe all of these areas in here. Now turn to the right please. A little bit more, a little bit more, and I can probe all of these areas in here from this position.